Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and we are getting ready to do a secret RF treatment. I'm getting numb. I just put my topical on about 10 minutes ago, so my lips are nice and numb, so if I'm talking funny, that's why. So Taylor is going to be my nurse who's going to do the secret treatment for me.
Hi.
And so because I just got my topical on about 10 minutes ago, we're actually going to talk about the treatment for a little while and then give me a little bit of time to get a little bit more numb. And then she'll start, and we're going to start with my neck. So secret we just brought in April, I think, and we're starting to see some really nice results with it. So what it is it's microneedling, but it goes deeper than your typical microneedling that we have and that you've probably heard about. And when the needles are in the skin, it has radio frequency, which radio frequency is heat. So this is what stimulates collagen. I feel that everybody needs to start with skincare and skincare that's going to stimulate collagen, and then the next step with anti-aging is some kind of a collagen stimulation treatment. So the secret, because it's microneedling and radio frequency, really is the best of both worlds because it's combining that and you're doing it in one treatment. And you should see tightening with your skin, but you should also see improvement of fine lines and wrinkles, all over. I mean, under the eyes, around the mouth, your jawline should tighten up. So let's talk about some of the, because you're seeing actually more of the before and afters than I've seen because you get to see the patients. So tell me what you're seeing and what patients are saying.
So it's different. It depends on the person. So I've had a couple of patients where they come back after one and they can tell a difference just by looking in the mirror, and then we take photos and we go over them and you can tell a difference in the photos. And then I have some people where they come back for their third and they're just starting to see some change after the third. So I think it just takes some time for that collagen to heal itself and stimulate, and then to see the changes where some people can do that a little bit faster depending. So definitely I think the most change is, the first place is usually the eyes where you see it. Okay. And then probably around the mouth, and the neck is another area. The neck probably is number 2, and then the mouth number 3.
Okay. And I think necks are so hard to treat anyway, and so I think this is definitely an excellent option for everybody because we all are aging and we want to you have to include that neck into when you're doing face treatments. And that is one of the things that we do here, and I don't know how other clinics are doing it, but we like to include the face, neck, and chest. So you're getting a lot of bang for this treatment. When we do microneedling, typically we do face, and then you have to add on the neck. So that's what I love about this treatment is that you're really covering the whole area. And like I said, you have to address that neck, because if you're just working on the face and your neck is looking saggy and have a lot of textural issues and lines, then you still are going to show your age, kind of like your hands. You really have to work on your hands as well because your hands show your age. So with Secret RF, we usually recommend 3 treatments to start, about a month apart. I'm actually 2 months now. I didn't get around to doing mine in July, but the good thing with it is that you can do it all summer long. And now that we're going into fall, definitely it is a great time to do the treatment. What else am I missing with it?
So maintenance treatments. After you complete the series of 3, some people may need 6 in a series depending on the severity of texture or scarring or lines. But after you finish the series, then we recommend maintenance quarterly. So doing 1 treatment every quarter, or even just doing a series every year is going to give you good results too.
Okay. So as I said, it's a newer treatment for us, but we're super excited about it. And I had a couple patients last week that I just touched base with, and they're like, "Oh my gosh, I can see such a huge improvement in the chin or the jaw area." And so that's what I want to see improvement with, just really this area, because that's what's showing my age or my little lines here. So, okay, so I'm gonna lay back, and we're gonna leave my topical on my face. Those of you who know me know I'm a big baby, so I'm going to try not to cry. Hopefully I'm nice and numb. Actually, I had this, like I said, 2 months ago. I did it right after old therapy, which is another way to stimulate collagen. It can go a little bit deeper than the secret, and it really wasn't that bad. So fingers crossed that we'll be in good shape here. My lips are so numb. We should do my lips. You need to inject them.
We're going to do your neck first, so we'll take the top of them off.
And I do think after one, I do think I saw a little bit of change.
Is this 2 or 3 for you?
This is 2.
Okay.
This is the second one. And I feel like, I just feel like I was a little more glowy. You know, I don't know that I could really see like this crazy change with, you know, fine lines or anything, but I do think that my skin glowed. And the other thing that we didn't mention is the downtime, which there really isn't any. Mm-hmm. And I do not like downtime at all, so I do really like this treatment because of that. And the next day I came in and I actually put even up on one side of my face and left the other side just a little bit red, and I had clinic and my patients couldn't tell the difference. So like I don't see the redness that you're talking about, and I could really see it, but they felt like they did it. Hey, get up a 4x4, please.
Sure.
Heather Watkins says, "Those arms, girl, wow."
Thanks. Thanks, Heather. That'll be good.
In your eye?
Yeah, I got a little topical in my eye.
Okay, I'm going to actually take this pillow out.
Okay.
Are you still comfortable?
Yeah.
Okay, and then can you scoot back towards me a little bit?
Sure.
Right, and then go ahead and turn all the way to the right. Other way.
Right. Do you need me to put my hair? I did bring it rubber band.
No, I'm just going to do this.
Okay.
I'll tuck it
Okay.
just like that.
Okay.
All right, are you comfy?
I am.
All right,
Okay.
here we go. So the tip of the handpiece has 64 tiny little needles in the tip of it, and they're gonna pulse. So they're gonna come out the top of this. I'll just do one little pulse here so you can kind of see. So it's really quick, and whenever they pulse, they deliver that radio frequency when it's touching the skin. So we'll go ahead and get started. Let me slow this down a little bit. Alrighty, here we go. Are you ready?
I think so.
Okay, here we go.
Good.
You okay?
Yeah. Yeah, it just, I mean, it's so fast.
Let's see if I can see it.
You would, can you see it?
Yeah. I can see it go down.
So you can see where she's already getting red, so I can kind of tell where I've been. And then as I keep going, it'll get a little bit more red. But then usually by the time I'm done with her whole face, the redness is already gone down some.
And if you do get, you know, more red than really what you want, that's where the Color Science products come in to help to cover it up. Tickles. It's all mineral and there are no chemicals in it, and so it's a natural product that you can put on and have great cover up, and that's what I was talking about with the Even Up. It covers up the redness, but it also has a little bit of ingredients in there to help heal the skin. And we use Color Science every single day as our makeup because it's the healthiest thing for our skin, but it's excellent for post-care. And then, of course, as I mentioned, skincare, we need our daily skincare for collagen stimulation, and that would be our TNS Essential Serum. And by using that every day, it's your at-home treatment. So we call this our in-house treatment, and then we do our at-home treatment, which is your products. The TNS Essential Serum stimulates collagen. The HA5 stimulates hyaluronic acid production. And then our Lytera is excellent for the removal and treatment of brown spots. So I think those are the 3 biggest treatment. Although I say that, I actually am in love with Lumivive, which is another Skin Medica product, and I've been using that religiously, and it has a morning serum and an evening serum, and the morning has blue light protection in it, and it helps, just your skin just glows with it. I had a patient in yesterday who said, hey, I've got melasma, and I really have seen a big difference since I started doing hydrofacials. And I said, well, what else have we done in the last 3 months? And we started Lumivive. And so her hyperpigmentation on her forehead was so much better because of the Lumivive. And then the evening serum is, it rejuvenates the cells. It helps to, helps your cells heal. So I'm really bad at my evening routine. I'm telling on myself right now, but I've been really good because I can see such a difference with Lumivive. So I definitely feel like it's a little more sensitive here in the center. Still nothing. I mean, it's like a 1.5 on a 10-point scale. So nothing terrible.
Chin up for me.
Thankfully, nothing terrible.
Good.
And you can do PRP with this. Actually, if you, or I guess, can you talk and do this? Can you do two things at once?
Yeah.
So it's hard to talk with the, oh, now that you're down here, I can talk.
Okay.
When you were under the chin, I was having a hard time. But PRP is platelet-rich plasma, and that's something that we draw your blood, we spin it down, and we use the platelet-rich plasma, and we infuse it into the little
Micro injuries.
Micro injuries, yes, thank you. And it helps to heal a little faster, but it also stimulates even more collagen. And we have a couple patients doing that, and they swear by it and feel like they see even better results. So maybe next time we'll do that.
Yeah, and see what you think.
Yeah. So as you can see, I feel a little heat. I don't even know how to describe the little needles because they're not, I can barely feel it up here. I can feel a little bit more down by my collarbone, but it's not even as bad as Botox.
You can see it stamped. It goes down.
Mm-hmm.
It goes down.
We're doing a lot of specials with the Secret RF and Ultherapy. And I mentioned Ultherapy earlier. Ultherapy just can go a little bit deeper in some spots. And so I still think that there's a place for it. It also uses heat energy. It's just not the radio frequency energy that this is using. So, our skin has layers, and the Secret's going to be the more superficial layers and can go medium depth, where the Ultherapy can go a little bit deeper than that. So I think the combo is definitely the way to go. I did Ultherapy with the last Secret treatment, so that's why I'm not doing that again. You typically do Ultherapy once a year, but that's what's going to help the jawline even more, is to do that combo therapy. So we have some great combo pricing and skincare combo pricing as well going on right now. Because as I said, and I say it every time, I think that skincare is essential to your treatment results. If you're not on our quality skincare, you're not going to see as great of results. And if you're going to spend this kind of money on doing treatments, then you absolutely need to take care of your skin at home. So funny because every once in a while I feel like a little nerve, just like shoots.
Oh, really?
Yeah. Felt it more like around my collarbone, but I just felt it in my chin.
Interesting.
Mm-hmm. Kind of like when Ultherapy, when you have it, doing it on the forehead, you get the little stingers.
Oh, yeah.
Yeah, it feels like that. I forgot I told my son I was going to work out this afternoon, so I'll probably have to skip that. Should have gone this morning. Okay,
So first round is done on the neck.
Yay. And how many passes do you usually do?
2 passes.
2 passes.
Yeah.
So will you do that right on top of it now?
Yeah.
Yeah.
Yep.
Okay.
Can you handle it?
I think I can.
Okay.
Yeah. Pretty sure I could do my tongue right now too. It's no. Have anybody asked any questions, Steph? No?
Not yet. We have a few people checking in for the contest.
Awesome. Yeah, tell them about the contest.
I wrote it in the comments to remember to say hello or ask us a question. If you check into this live video, your name will go into a drawing for a secret RF treatment.
Ooh, awesome. That's exciting. Yeah, I can seriously barely feel it now. Would you say 2 passes or 3 passes?
2. So the first one was at 1.0 millimeters. This one's 0.6.
Okay, so that's why I can barely feel it because it's a little bit less.
Yeah.
So just hitting different depths.
Yeah. Hitting different depths helps to, stimulate collagen at the different layers of your skin. So we can go up to, I think, 3 millimeters with the Secret RF. That's really mostly for like really, really deep lines. The neck is just a little thin to do that deep.
And that's why I really prefer the Secret over Ultherapy, because you just, the skin is so thin, and Ultherapy is definitely a little bit more intense, and this is not. So one reason why I like this one better for the neck. Go ahead, sorry.
We have one question. Sherry wants to know if it stings and that it's making your skin red. She'd like to know how long does the redness last?
Okay. Stings, it really doesn't sting. I mean, I can feel it when the needles are in. I can feel it just a little bit. I wish I could compare it to something, but it's not even like if you poke yourself with a needle. It's not. It's nothing like that. It's like so simple. The redness will probably last 24 to 48 hours. Most people, it's less than 24 hours. So for me, last time it was less than 24 hours. I never know what my skin is going to do, so mine gets angry all the time. How's it looking right now? Is it?
You're pretty red.
Pretty red?
You're pretty red.
Yeah. So I will definitely do a follow-up tomorrow too, so we can see, what it looks like tomorrow. But the majority of the patients, would you agree, Taylor? Since, like I said, you see them more than
Yeah,
me.
it's pretty much by the next day. It's subsided a lot, but there is some that still have a little bit of that underlying redness the next day. Which again, you can wear all the Color Science makeup day 2. And it's safe, so you can easily cover what redness is left on day 2.
Yeah.
Marianne asked, is this helping reduce wrinkles and loose skin on the neck and chest area?
Yes, and so it's helping with the fine lines and wrinkles. It's stimulating collagen, and so it's going to help to tighten up the skin as well. So that's what we love about it, is it does so much for you that the collagen stimulation is going to be what's tightening, but then the textural changes that this will do are just amazing, because it's going to help with those fine lines and wrinkles. It's not going to take away deep lines, but it can definitely help to soften them. And to go back to the stinging, like now that she's done on the other side, I don't feel it at all. It doesn't feel like it's burning. It doesn't, I really don't feel anything. No heat, nothing with it. So probably because I'm having little needles on this side. So we'll see what happens after that. But surprisingly very comfortable. I think, does it get a little worse with the forehead?
Usually, yes, the forehead is the most sensitive just because there's skin and bone up there. And then around the eyes can be a little sensitive too, but definitely forehead's the worst for most people.
So we'll do that last.
Okay.
So my topical is all kicked in by then.
Did I finish her question, didn't I?
Mm-hmm.
Okay. So the other thing, talking about skin tightening, is you can actually do this anywhere on the body. So, most people are coming in here, they're doing, they want the anti-aging for the face, but you can do this on the abdomen, on the arms, on the legs, and that's what I like about it too. We've done a couple of abdomen treatments in conjunction with Cool Sculpting, and I personally have not seen the results. Are you doing that one?
Yeah, they look amazing.
And did she have stretch marks too?
Yep.
Yeah. So I really need to see those photos. But she was one of our patients that we thought, well, let's see what we can do with this. And you think she's having great results? Mm-hmm. Is she happy with it?
I think so, yeah.
Good. And how many Cool Sculpting treatments has she done?
She still has to do her second round.
Okay.
But she's only done 2 secrets too, so she
Oh,
has one more.
wow. So that's what's cool about the secret too, is that it's great for other areas. Now, is this getting my chest too right now, or no? Okay.
So I've been saving the chest for last because I'd rather focus on the areas of main concern, and then if we have enough, then work on the chest.
Got it.
Unless the chest was the biggest concern, then of course I would start there.
Right. And obviously, what's important with doing face and neck is that it's all connected. So you don't want to just do neck, just do face. You want to make sure that you're getting that collagen stimulation all the way up to the, on the forehead. So typically, how long is a treatment?
I would say 45 minutes.
Okay, so
to do
that's
the
not
actual
bad.
treatment, no. And then we typically will leave the topical on anywhere from 30 to 45 minutes. Sometimes I'll come in at 30 and just start on the neck, kind of like we did with you, and then kind of work my way up. And by the time we get to the upper face, it's been on for a little over 45 minutes actually. So now we're gonna do your lower face.
Okay. So am I pretty red?
Yeah, your neck's pretty red.
Yeah.
Just gonna check the time.
How's it feeling now?
Feels fine.
No heat or anything?
No, not
Good.
really. I mean, maybe just like in the center, like I can feel a little bit. So what do you typically recommend for right after post-care?
So right after we're done today, I'll put HA5 on. So that's just going to help to pull some hydration and kind of soothe the skin a little bit. And then I recommend HA5 after for the next couple days. And then the next day you can wear sunscreen if it's the Color Science Mineral Natural line.
Okay.
It's safe. But really, just right after we'll do HA5, and then you can add HA5 throughout the day if you need more.
Okay. And that seems to be enough.
Yeah, seems
Okay.
to be. Yeah, people say it really does help.
Okay. So I think with old therapy, the chin is, or the jawline actually hurts the worst. So we'll see how this goes. I feel like I'm nice and numb. Like I said, I can't even barely move my lips. Truth to say.
Okay, so I'm gonna try these new settings.
Okay.
Here we go.
Oh my gosh, I feel it even less.
You
So,
do?
Yeah. So are these like the stronger heat?
So heating up the skin faster.
Faster?
Yeah.
Heat it, sister, heat it. Yeah, I barely feel
Really?
it. Yes.
Okay, can you feel this? How'd that feel?
Fine.
It did?
Yeah.
Okay, well, let's do that then.
So that makes it slower.
So that's slower. So
And I can feel it.
I feel, I don't know. I think that maybe heating it slower might be
Better. Yeah.
Because I tested this out on my mom. Like, what hurts more? Just like I did to you.
Yeah.
And she was like, ow, this one hurts more.
Yeah, I definitely feel it more.
Okay.
I mean, it's not like a 3, maybe.
Really?
No, 2.5. How about that? It's definitely, I don't want to say intense, but I feel it.
Okay, well, you just let me know if
I
it's too
will.
much.
Hey, I want it.
I want those results.
Yeah, like I can feel that through there. I think because you've got your little nerve running down there.
Mm-hmm. Hit these lines over here hard so we can get them gone.
Yeah, see on the jawline, I definitely think you can feel it more. But hell, if I can do a little therapy, I can do anything.
Yeah, you can.
And the beauty of it, it's like 2 seconds.
Mm-hmm.
You know, so even if you feel it, it's literally 2 seconds.
I love how smooth it stamps. It's not like a punch.
Yeah.
Mhm. Yeah, and I think that helps too, you know, because it really is smooth and
I love how you don't have to drag it across
Right.
the skin.
yeah.
Sorry.
No, it's not bad. It was just a different spot, so it wasn't used to it.
Yeah, you don't look like you're feeling it.
No, I could
There's
probably
like no
fall
flinching.
asleep.
Can you feel the warmth?
I do not feel the warmth on this. I feel like maybe like in the very beginning when she started on the, you know, right at the chin, but I felt it more in the neck. Like I don't feel this at all. Felt that one. Definitely sensitive there.
Okay, we're gonna go down.
Do you guys want to do a sign off for the live? And then I'm gonna switch
Yeah,
to
right.
Instagram.
Yeah, are you ready for us to?
Yep.
So, okay, well, I think you know pretty much got the idea of how easy Secret RF is, and if you have any questions, please let us know. And if you want to come in for our consultation, give us a call at 618-288-9117. See you soon.